Maburg virus, also known as Marburg virus, was first discovered in 1967. The outbreak occurred in Marburg and Frankfurt, Germany, as well as in Belgrade, Serbia, which was part of Yugoslavia at the time. The virus was traced back to African green monkeys imported from Uganda for laboratory research. Marburg virus is a member of the Filoviridae family and is closely related to the Ebola virus, causing a severe and often fatal hemorrhagic fever in humans and non-human primates. Marburg virus, like other filoviruses, is transmitted to humans from animals and can then spread between people. The primary transmission routes are animal-to-human transmission. The natural reservoir for Marburg virus is believed to be the African fruit bat, Raucetus aegyptiacus. Humans can become infected through contact with the bodily fluids or tissues of infected animals, such as bats or non-human primates. Human-to-human transmission. Marburg virus spreads between humans through direct contact with blood, secretions, organs, or other bodily fluids of infected individuals. The virus can also be transmitted through contact with surfaces and materials contaminated with these fluids, like bedding or clothing. Healthcare settings. Nosocomial, healthcare-acquired, infections can occur if proper infection control measures, such as the use of personal protective equipment, PPE, are not followed. Unsafe burial practices. Handling the body of a deceased person who was infected with Marburg virus can also lead to transmission if protective measures are not taken. To prevent the spread of Marburg virus, it is important to practice good hygiene, use PPE when caring for infected individuals, and follow proper infection control measures in healthcare settings. Marburg virus disease, MVD, is a severe and often fatal illness in humans. Symptoms of MVD typically appear abruptly and can progress rapidly. The incubation period for the disease ranges from 2 to 21 days, with symptoms usually appearing around 5 to 10 days after exposure to the virus. The symptoms of MVD can be similar to those of Ebola virus disease and include fever. A sudden onset of high fever is one of the first signs of Marburg virus infection. Chills and severe headache. Along with fever, patients may experience chills and intense headaches. Muscle aches and weakness. Generalized muscle aches and weakness can occur, which may be severe. Nausea, vomiting, and diarrhea. Gastrointestinal symptoms, such as nausea, vomiting, and diarrhea, are common. Abdominal pain. Patients may experience pain in the abdominal region. Chest pain and shortness of breath. Respiratory symptoms like chest pain and difficulty breathing may develop. Rash. A rash may appear on the skin, typically around the 5th day of illness. As the disease progresses, more severe symptoms can develop, including hemorrhaging. Bleeding from internal organs, gums, or puncture sites can occur. This bleeding may manifest as blood in vomit, stool, or urine. Organ failure. Severe cases can lead to multiple organ failure, such as kidney or liver failure. Shock. Patients may go into shock due to blood loss or organ failure. Neurological symptoms. In some cases, patients may experience seizures, confusion, or altered mental status. The case fatality rate for Marburg virus disease varies between outbreaks but can be as high as 90%. Early diagnosis and supportive care, such as rehydration and treatment of specific symptoms, can improve the chances of survival. However, there is currently no specific antiviral treatment or vaccine available for MVD. There is currently no specific antiviral treatment or vaccine available for Marburg virus disease, MVD. Treatment for MVD is primarily supportive and focused on managing symptoms and complications. Supportive care for MVD patients may include rehydration. Oral or intravenous fluids are administered to help maintain electrolyte balance and prevent dehydration due to vomiting, diarrhea, or fever. Pain management. Medications may be given to manage pain, such as headaches, muscle aches, or abdominal pain. Fever control. Antipyretic medications, such as acetaminophen or ibuprofen, can be used to manage fever and alleviate discomfort. Antiemetics. Medications to control nausea and vomiting can be given to help prevent dehydration and electrolyte imbalances. Hemodynamic support. In severe cases, patients may require blood transfusions or intravenous fluids to manage hemorrhaging and maintain blood pressure. Organ function support. Dialysis, mechanical ventilation, or other supportive measures may be needed to assist failing organs. Antibiotics or antifungal medications. These may be prescribed to treat secondary infections that can occur due to a weakened immune system. Close monitoring. Regular monitoring of vital signs, blood chemistry, and organ function is essential for timely intervention and adjusting treatment as needed. Prompt diagnosis, isolation of infected individuals, and proper infection control measures are crucial for preventing the spread of the virus. Researchers are working on developing vaccines and specific antiviral therapies for MVD, but as of my knowledge cutoff in September 2021, none have been approved for widespread use. Preventing Marburg virus disease, MVD, involves reducing the risk of exposure to the virus and implementing appropriate infection control measures. Some general guidelines for preventing MVD include: avoid contact with bats or non-human primates. Since Marburg virus is believed to be transmitted to humans from infected animals, it's essential to avoid contact with fruit bats or monkeys and their body fluids or tissues. Handle animals and animal products with care. If you must handle animals or animal products, use protective clothing and proper hygiene practices. This is particularly important in regions where Marburg virus is known to circulate. Practice good hygiene. Washing hands frequently with soap and water can help prevent the spread of many diseases, including MVD. Safe food handling. Cook animal products thoroughly and avoid consuming raw or undercooked meat. Also, avoid contact with sick animals or spoiled meat. In healthcare settings, strict infection control measures should be implemented to prevent the spread of the virus. Use personal protective equipment, PPE. Healthcare workers should wear appropriate PPE, such as gloves, gowns, masks, and eye protection, when treating patients with suspected or confirmed MVD. Implement isolation procedures. Isolate patients with suspected or confirmed MVD from other patients and restrict access to their care area. Properly dispose of contaminated materials. Safely dispose of needles, sharps, and other contaminated medical equipment. Sterilize equipment. Clean and disinfect medical equipment and patient care areas. Monitor healthcare workers. Regularly monitor healthcare workers who have been in contact with MVD patients for any signs of infection. Safe burial practices. Ensure that the remains of deceased MVD patients are handled and buried safely, with appropriate protective measures in place. Community education about Marburg virus disease and its transmission routes can also help prevent outbreaks. Although there is currently no approved vaccine for MVD, research is ongoing to develop effective vaccines and treatments for this deadly disease.